Really, it started when we moved to Arkansas about 3.5 years ago. My wife has had dental issues for most of her entire life, so it's really based on what kind of care that she was looking for, because she really wants to make sure that her health and her teeth, and it really was because it involved the front of her teeth. It's important that we could find somebody who was cared about the quality, the look, also the work, so that we don't have to continue. It seems like a couple dentists in our past, we've had to continue care quickly after seeing a dentist because either something didn't go right or everything wasn't fully explained to us. So when we moved here, it's always kind of a battle because we're both in sales and marketing, so we've moved quite a few times. And trying to find a dentist in our situation, trying to find a dentist when you go to a new city is not the easiest thing to do. And really, most of the time, what we've done is used research on the web or just talk to coworkers, which is typical, or friends and neighbors to find out, what kind of care they've had. And then you really have to listen, because it depends on what your opinion is of dentistry, on what you're hearing people say. Do they really cared about their quality of care? Are they really just there to just get a tooth filled or something quick fixed? And we're not in that situation. So moving here, it was really word of mouth which drove us to Dr. Lais, and then it's that uneasy feeling of taking someone up on that recommendation, coming to the office for the first time, and then you have expectations in your head, kind of what you're going to get, what kind of quality of care you're going to get, what kind of service. And really from day one, on both her case and my case, the staff here has been incredibly professional, very personable, and I think what has stuck out probably the most in both of our experiences here was the emptiness of the office. So as weird as that may sound, it turns out that the reason that's so is because Dr. Lais does schedule very much one-on-one time with you, which is different than a lot of cases we've had in the past. We haven't had too many dentists where you don't see a couple folks in the office and they're back-to-back, so he's coming in and out of the office. But Randy spends a lot of time talking with you one-on-one, and finding out really what's going on with your health, and explaining the things that are happening in your mouth with your teeth and how that can affect other parts of your life, how that can affect your health, how that can affect other things than just what you typically think of when you come to go see a dentist and you go get a tooth fixed. So over time, that's parlayed into not only him taking care of my wife's issues, which is really the key of what the care that we picked here, but then for myself, having questions that I've always had with dentists over the years, and being able to ask Randy and actually getting 30 minutes of his time to sit down and explain why it is the question I'm asking, what's happening, with my teeth, whereas in the past, haven't really had that. And so that has led to me, asking him what else can he do for me, in different, and a lot of times, cost comes into play, and it does certainly, but based on your budget, it depends on what do you want to weigh. You weigh in the quality of care, or you weigh in, how much you're actually going to pay for it. And really from the work that I had done, it was as much the quality of care and what we ended up with and the way I ended up looking and feeling, and then also what has changed in the health of my mouth. So for me, it was specifically, it took years of bruxism, which is grinding, to wear away my teeth to the point with me having a bigger lip. You really can't see my teeth. And part of that has been that I've worn away, and Randy explained over time, at night, the grinding at night really wore away a lot of my tooth structure. And I could see it myself because the teeth were flat on both surfaces, and I really didn't know what that was. I just knew my teeth were little. And then as he explained it to me, then he explained the options. And the nice thing about the options that he explains were, he gave me a range of options. There's quick fixes that you could do just to temporarily change the look, and not that expensive. There are certainly the top-end Hollywood-type look that you can achieve for a very expensive price. And then there's a range of options in the middle. So really him having that open discussion and giving me options on what I wanted and what he could provide, it was very comforting in making decisions, which is not not a short-term decision. It's a long-term decision when it involves a lot of money. And so having that options laid out very clearly, it made the decisions a lot easier to make. And again, that was both for my own case and then for my wife's more intensive work case. It was really the time that he took, understanding of her since she was, I think, 6 years old, the fear that she's had going into dentist, and he quickly understood. You pick up that very quick, and the care that he would give to her, and making sure that she was comfortable with what he was going to do. He would even call her before she would come to the office to explain what he was going to do and how long it was going to take, what options he could do for relieving any pain that might happen or any anxiety before that. He would give her a call beforehand, before she even got here, not once she's in the office and having to make that decision on the fly with all that fear. So it was a lot of the time that he spent and the care that he gives to his patients. The staff starts to treat you that way right off the bat. So they get to know you as personable as Dr. Lais does, giving you the same quality of care, the same thoughtfulness of what she's doing as a hygienist, just cleaning your teeth, and what she sees. So it's definitely evident of the education that they're pushing throughout the office, which is, again, a comforting feeling as a patient. One of the other pieces that's really interesting is we've had a couple scenarios here with Dr. Lais where he hasn't been in town. He's either been on vacation at some kind of continuing education for him, and that we've had a dental emergency. And it's happened twice, once in my case and once in my wife's case. And what was really interesting and different about Randy and his practice that we haven't seen in other practices was his interaction with the other dentists in the area that he does his research group with. He quickly was able to, on his cell phone, from wherever he was, make a call, put us in touch with another local dentist here that he trusted that would handle the work the way he does it. We were able to quickly go to those dentists. They handled the problems. And why I say it was interesting is because at their practice, they were very careful and meticulous about the work they did, because they knew Randy as a perfectionist. So understanding that they, as a perfectionist as he is, they did quality work to make sure that when it came back and Randy took care of it after he got off vacation, that it was clear that they took care of us as much as he would take care of us here. I certainly have my own perspective when it comes to what I think of when I think of health and teeth and budget, and I would be able to talk to somebody and quickly understand probably what they're coming from, what they're looking for, and it would be very easy to explain what Randy could do for them, what Dr. Lais's practice does, what they would experience here. It really depends on, I think when we talk with somebody, what they think is important in their dental health, and it would be very easy for us to refer to Randy.